Our guest now, Senator Richard Burr, Republican of North Carolina, member of the Health, Education, Labor, and Pensions Committee, one of those committees of jurisdiction in the Senate on health care. What is the GOP floor strategy at this point on that reconciliation bill?
Well, Paul, the GOP really isn't in control. I think America's realized that. The strategy is to work with the majority to try to offer perfecting amendments to try to fix things that were broken. You know, this is not the way Washington's supposed to work. We're not supposed to pass legislation knowing that it's flawed in an attempt to go back and fix it. There are areas for our veterans, for their families that aren't covered in this bill. We're going to have clarifying amendments on that on the floor. But this process has been a lengthy process. Now, 8 months I've been involved in health care reform, through hours of markups, through long debates on the floor. Unfortunately, we didn't end up with a bill that I could support, but we're going to have to try over time to figure out how to make this bill affect positively the American people.
So this bill being the law of the land, as they say, I want to throw a couple of other words your way as part of the Republican mantra now. Repeal and replace is what we heard a lot about yesterday on health care. What does that mean to you? Well,
it means that the current bill, if you're not supportive of it, if you believe that it drives up the cost for every American, and that the expansion of coverage could have been done much less expensively and much more effectively, then I think you have an obligation to the American people, the electorate that put you here, to try to repeal the bill. But I don't think it's good enough just to repeal it. I think you've got to make a promise to replace it. I, along with Tom Coburn, Paul Ryan, Devin Nunes, introduced comprehensive health care legislation last May. That's almost a year ago. We were the first members of Congress to introduce comprehensive legislation. It expanded coverage. It didn't require any additional taxpayer investment. It really addressed health care cost, and I think that's the big disappointment that the American people are going to find, is that health care cost is what's killing our system. And if we don't drive down that cost, it's no more affordable for the next person or the next generation than it was the last.
We'll take your phone calls for the senator. Separate lines for Democrats and Republicans and independents. Senator Richard Burr is a Republican from North Carolina. He used to serve in the U.S. House from 95 until 2005. And here's a headline, Senator. Wall Street Journal, Republicans begin strategy rethink. They're saying that the administration's passage of a sweeping health care bill has scrambled Republican strategic calculations on the Hill. They're basically saying when it comes to financial regulation and No Child Left Behind, the strategy may no longer be no, as they put it. What do you take?
The strategy's always been to try to produce the right policy for the American people. I think when we look at education, look at the health care bill. Did the takeover of the federal government for student loans, is it appropriate to have that in a reconciliation bill? Is it appropriate to take $9.1 billion from student loans to pay for health care? I mean, in essence, what they're saying is we're going to overcharge every student in America on their student loan so that we can balance what we need for the health care bill. I don't think that's what the next generation of higher education signed up for. So as we work through the reauthorization of elementary education, as we work through some of the other bills that come through Congress, it's not that we're going to be opposed to them, it's we're going to try to structure them in a way that the American people benefit from it.
Oklahoma City, Oklahoma. First call, Brian, independent for Senator Burr. Good morning.
Hello. I had a few questions. I wanted to ask the senator, number one, has there been any kind of thought into how this is going to affect the U.S. dollar on the global market in the long term? And number two, why are they calling it health care reform when it's actually health insurance reform? And number three, why can't they... I actually had a plan that I submitted that called for, number one, actually it would require what they did, repealing the McCarran Act where they had the antitrust. Number two, it would allow people to buy insurance from across state lines. And then number three, it would require insurance to say that right across the line, age and then age and then price of the insurance coverage that you're going to be paying for the plan, you know.
Thanks. Left a lot out there. Want to respond to
all good points. As we spend more money than we take in, we run the risk of having inflation hit the U.S. system, a devaluation potentially of our dollar as our debt grows. All of these things that once we thought were unthinkable are now possible. We owe $13 trillion in debt. That requires a $5 trillion interest payment projection over the next 10 years. These are all real numbers, and they take away from the discretionary spending side of the needs of the federal government for the next 10 years. CBO projects that in 10 years, the interest on the debt will be $800 billion a year. Now, that's the size of our discretionary spending, and in the discretionary side is our entire military. So this is a huge potential deal, and I would agree with the caller that this really isn't health care reform. This is health care expansion, coverage expansion. We've done nothing to address the cost of health care. And many of the creative things that Americans sent us in emails, that private companies that were self-insured tried within their own ranks, like Safeway, where for the last 5 years their health care cost has gone up 0.5%. Because of innovation in healthcare, we incorporated none of that in this plan. And I think what the caller mentioned, just a few things, purchasing healthcare across state lines, has a way of driving competition, addressing tort reform, has a way of affecting the cost, making sure that individual Americans can construct their own health care to meet their age, their income, and their health conditions. We do everything else in our economy that way, except for health care, and I think that to create more competition would be a great thing for the system.
One of your constituents on the line now from Mooresville, North Carolina, Rhett, on the Republican line. Good morning.
Good morning, Senator Burr.
Rhett, good morning.
Good morning to you, and sorry I missed you last week when I was in D.C. for the League of Municipalities. Stopped by your office, and your staff was very, very helpful and gracious. I would like to look toward education a little bit. You are a strong advocate of education in our state, and I'd like to thank you on behalf of Mooresville Grade School District for all your assistance. A lot of people around the nation don't know that North Carolina, we are a cutting-edge model for education, especially in Mooresville Grade School District. We have a one-to-one digital conversion going right now, where all students from 4th to 12th grade have a MacBook 24/7. We are changing the model of education in our classrooms to prepare our children to succeed in the global economy of the next century, and that's been a credit to you and also a lot of our forward-thinking educators here in the state. I've also been able to speak with Secretary Duncan and tell him about our model and invite him down. But I just want to get your ideas on how we're heading into the future on education. And also, again, thank you for all your assistance, and we hope you'll come by and see us next time you get a chance.
Rhett, I look forward to the opportunity, and thanks for what you're doing in the community there. And Secretary Duncan is one who I think understands the transition we need to make in K through 12 education. We'll have differences on certain things, but I think we're headed for the same end goal. And I think for North Carolina, for any state, functional, successful, effective K through 12 education means we've got a larger pool of talent that goes on to higher education. I'm blessed with the fact that I represent a state that produces the second largest pool of graduates of higher education annually than any state in the country other than California, and that's 4-year, 2-year, public and private. And it's that asset that North Carolina has that attracts 21st century investment in our state. So education plays an integral role in economic development, the livelihood and success of a state and localities. And I think as elementary schools begin to take on the responsibility of transitioning themselves, they recognize the fact that the next generation doesn't learn the same way I did. That just throwing a textbook in front of them means that you lose a certain percentage of them, because that's not the way they learn, it's not the way they communicate. For most adults today, just simply look at your children. They pick up a cell phone not to make a call, but to send a text. When they look to take a picture, they don't look for a camera, they look for their cell phone. It's a multi-use device. And I think we've got to begin to incorporate some of that change into the classroom that they experience every minute they're outside the classroom. And I think it can be more effective. And I just applaud Red and the local community. But across this country, we've got models of success. What we've got to do is try to figure out how to export that everywhere else. And it's we can't look at it and say cost limits our ability, because it's not always putting an iPad in front of a student. In many cases, it's simple changes that we can make that change the way we communicate with the next generation.
What is your understanding of what the President, the administration, has had to say about education standards they've started rolling out?
Sure. I applaud Secretary Duncan's efforts. I've looked at the blueprint. There are many things in the blueprint I can support. I think creating competition in education by allowing charter schools to grow. Charter schools are the result of parents' dissatisfaction with the monopoly system. And when parents choose to do that, I think we should support those parents. And through that competition, we're going to make failing schools better through the attraction of the right leadership, the right teachers, the change in the curriculum, the change in the way they teach. But more important than that, I think that we've got to look at, are we teaching our teachers in education the right way to teach? And I think that's something we've got to focus on higher ed to look at and track these teachers for at least 5 years.
Toledo, Ohio.